good morning and Happy New Year to you.
Good morning and Happy New Year. Is this our first program for
Our
the year?
first program for 2022.
You know, it's so funny. We keep doing this and I forget timing and I forget it's the new 2022. And all the best to you and to the Federation for this year. Hopefully we can be able to conquer COVID and move on.
Well, it looked as if we were turning around the bend at the end of 2021. And then we were gifted with, on Christmas, with a new variant. And here we are with it.
Absolutely correct. It was, I can't say it was strange. I think that some of the things that we have spoken about and the ability for the virus to replicate will always produce these changes that occur, the variants and the variation, and you know, and the variants and variation that we see, some of them are very difficult to control, where others are, you know, flu-like symptoms and then move around. And you know, whether it adds to the concept of the origination of the virus itself, in that, you know, virus, when it gets the ability to multiply, it can change. And hence, in this situation, you can, you know, look back and see that possibility that this virus, which, I mean, some people have been saying that it came out of the lab and all this stuff, but if you have a virus like COVID, SARS-CoV-19, that is developing and growing all its years in a bat community, and if it keeps getting bats to multiply and multiply, it can change. And in one of the situations where it changes and it becomes a different variant, that's how we can see it scientifically jump in species. And here we are witnessing how these changes can occur, because once it jumped the species, which was what happened in December 2019, to the human species as the vector and the carrier of the disease, it then continues to multiply, and hence we had the alpha, because it changes, it's varied. We had the beta, the delta, and now the omicron. And so what we're seeing is just the natural propagation of virus and virus changing that we see at developing. And here, and most people are thinking now, with your new variant, which you just remembered, it just popped up around December, the Omicron, it seems like it's very, and we know it's very contagious, but the symptoms are very flu-like, very simple. And so if that change, possibly, and I keep saying this to a lot of my colleagues, that this might be the variant which is going to be the one that will stop the spike, because if everyone, because it's so contagious, is getting this disease itself, we are developing some natural antibodies, and with the natural antibodies, with the vaccine antibodies, we will probably get close to herd immunity just naturally with protection, and all we need is just the extra help to get us through and protect us all from this disease. So this might be the one that might help us get to herd immunity and get control of this disease level.
You know, Doc, I wanted to know, we had mentioned the origin of this COVID-19, China, and somehow we don't hear a lot coming out of China in terms of the effects that the different strains are having now. Is it that they have done a better job of controlling it?
You know, and to be honest, because they are so regimental, it's a matter of control. It seems like with them, because of the fact that, you know, once the government decides to mandate or to instruct the people on what to do, they in their society have to follow that instruction. And it seems like they are doing and getting better control of the disease. We're still seeing some of the spikes, and what we're seeing there also, because of the international travel, we've seen a lot of different variations and changes in China that has occurred. And also you got to understand too, Weber, they're very tight-lipped with their decisions, what they do, their numbers. And so in essentiality, you have to be very careful when you start to compare their control versus the way how the Western world is do things. And so, yes, in essentiality, because of their regimental nature, they are doing and getting better control of the disease than we are. One of the things that I would say about some of the things that are going on in China is that one of the vaccine, the Sinopharm, and again, I'm looking and observing at things. One of the vaccine, the Sinopharm, is what we call the very, very old school vaccine. There's like what we did with polio. It is an attenuated virus. That is the SARS-CoV-19. They cut its virility, the ability to be contagious to whatever, and just give you one of the virus. It's either killed or attenuated, and that's what makes up the Sinopharm. So when they give you that vaccine, you develop antibodies, and that is considered to be a natural antibody because you are getting the virus. It's just that it won't give you all the disease entity, but your body develops the antibody. And what we have found, especially now in the Western world, where China has given these vaccines out, if you remember, there was some data coming out of Seychelles, where nearly 60% of the community was vaccinated, and majority of them were vaccinated with the Sinopharm, maybe 1 or 2 dose Sinopharm. And what they found was that the breakthrough infections occurred more so with the Sinopharm vaccine, showing to us that since it's an attenuated natural immunity, that the natural antibody, again, I'm just looking at the data, Weber, and I just want your public to understand what I'm looking at. So I am extrapolating from that data that because this is now a natural antibody development because it's a killed virus. And so what they found with that those people in the Seychelles were getting a lot of what we call breakthrough infections, especially if over a period of a month or 2 you have gotten the vaccine. It seems like they crossed the breakthrough infections mostly affected the Sinopharm vaccine, saying that to say, again, the natural immunity that you get from this, from getting the virus or whatever, is not long-lasting. And it's not the best protection you can get because people will say, oh, I've got the disease, so I am vaccinated, I have antibodies there, and so. But what this data is showing is that those people who get Sinopharm will more easily get breakthrough infections, stating, just by observation, Weber, that the immunity gotten naturally doesn't last as long as if you were vaccinated.
Doc, to follow up on a point that you made in explaining with China, the regiment that they operate under, and therefore, because I've been observing as well, had we been a people who perhaps were more cooperative in the measures and the rules that were put in place, we might have been getting better results?
Absolutely correct. And again, Weber, and you're right, you can use China as one. Let's look at Taiwan. In the initial days of the disease, Taiwan was one of the first places that started to do the mask mandate and the hand washing mandate. Taiwan. And so they had a spike and then it dropped off completely. Again, they were very regimental and their government maintained and tell them, look, this is what you're going to do. So not only China that we're seeing that the people who regimentally follow instructions because of their society and this and there's a yes, you are absolutely correct. They do better because they're following the instructions and directive of most of the scientists.
The current variant that we have now, and I've been curious as well. We have now, at least in St. Kitts and Nevis, the main variant is the Omicron. Just before that, our data showed that the Delta was present, and then our main one before the Delta was the Lambda. Now, I'm curious, Doc. It seems to me as if when you had the Lambda and then the Delta came on this year, now the Omicron, you don't hear about the one before. So the question is, can more than one variant exist at a time? Or the one that comes latest maybe kills or eradicates the others?
Well, I don't know so much about the kill or the eradication, but what I do know is this. With all that was going on with all the different variants, what also was being propagated was the vaccines at that point in time. And this is really an understanding demonstration of how the vaccines were working. And the vaccines at that point in time, and you're absolutely correct, there were all these different variants, but what we were noting at that time, the vaccine was kicking in, and these variants were becoming less and less. And we still, and don't drop your guard down, we still have some of those variants around. There are one of two cases where, because the Delta, the Alpha, Beta, and all of those were very aggressive on the lung tissue. Very, very aggressive. And that's why we were seeing people getting on the ventilator and dying. So we are now seeing that we have minimal amount of the earlier variants because they disappear. One, because the vaccines have been helping us get rid of majority of those. What we're noticing now with this variant, because it's so contagious, it spreads more easily between persons to person, and the fact that, Webbo, we are totally asymptomatic. Most people are asymptomatic with this variant, and so therefore it's easily carried, especially the kids, to the family members, to the household, and it spreads right out. People are asymptomatic. They don't even know they have this disease entity. And so contact tracing that we're trying to do now is totally useless because nobody have no symptoms, they move around. And sometimes you test and initially it's negative, but 3-4 days later, because the viruses keep multiplying, we start to see. So in essentiality, Webbo, what we're looking at, and I say sometimes that people look at me like I'm straight, I say God is good. Because what he has given us now is a variant that is very contagious, so that majority of us, or maybe all of us around at the end of this period, before anything else varied, would have gotten natural immunity because we have picked up this disease unknowingly because it's totally asymptomatic in most people. And so majority of the people will get it, will have herd immunity from this variant, and we might be able to move forward. And I think this is to the point where we might be able to eradicate majority of the virus, because the other virus is not spreading around, but this new one has given us an immunity which will help protect us. But it's not a long-lasting immunity, and that's why I went back as far as to the Sinopharm vaccine, Webbo. It doesn't last long. This is why you need to step up your game and get more protection with the vaccine in order for you to prevent, one, the older variants from coming, and if we have developed enough immunity from this Omicron, then we will have enough herd immunity to protect us and project us well. And in essentiality, the variation that we're seeing now seems like it's going to be more beneficial to the human population than the other ones, which was killing us. Here we're getting some immunity and protection, and we're moving on.
Doc, for the records by way of information, is it the Omicron, the prevailing variant in Antigua as well?
Absolutely, all over, between here, between Tortola. When you look at the data, Montserrat, when we look at St. Lucia, when we look, and that's what we're seeing. Again, we have a good thing, very contagious, but not destructive. Not destructive, not as infectious as any other thing. Whether I can't stress this no more, maybe it's a good thing, because we're getting some immunity. I think that what we need to do is that, because no matter how we try to protect, if you notice, the numbers are so high, you're wondering how everybody getting this disease. Maybe we did drop our guards, but also because of the contagious nature of it. And again, Weber, most importantly, majority of the people are asymptomatic. When we look at the data coming out of South Africa, by the time we finish with all these programs, the whole community and the whole federation will understand about data and specifics and sensitivity and everything. Because when we looked at the variant, and they're claiming that it came out of South Africa, a country which only about 14% or 20% of the population are vaccinated. So the virus had this ability to propagate down there and change. As I say, more virus multiply, the more is the ability to change. Every time it replicates or make young ones, those have the ability to change. And so in South Africa, where they were unvaccinated, these variants developed. But what they found in that data was that 76% of the people with that variant were just picked up incidentally, Weber, incidentally, traveling or going to the hospital for a procedure. They test them and they found, and these people had no symptoms, none whatever. The 4% that they found out was sick were most of those 4% were unvaccinated people, and they had just minimal respiratory symptoms, and then the other 10% of that 4% were in the ICU, which was a very small amount, again, unvaccinated, but they had the disease. So the majority and the prevalent people with the disease were asymptomatic carriers, Weber. So what I'm getting at, and why I went back as far as back to South Africa and the development, is that we're still seeing the same data. We're still seeing majority of the people now in the Caribbean, in Trinidad, and everywhere else have this new variant, which again, Weber, nobody kill me, might be one of the better things to have right now, because you get it, you recover, you're asymptomatic, which is a good thing, and then you develop some antibodies. But bear in mind, those antibodies you develop, they don't last as long as if you are vaccinated and boosted. And again, more and more of the data is showing the people who are vaccinated and boosted are very well protected from the Omicron variant. Okay, Weber, so that's what the data is showing out there. So yes, majority of the cases we're seeing now in the Caribbean is the new variant.
You made a mention that by the time we're finished with these sessions and so on, one of the things that has been happening is that people are more informed and more educated, and as a consequence, they are displaying that. Here's the thing, Doc. The current variant, which is the Omicron, has certain symptoms. And there's been a lot of debate now that everybody is analyzing whether it is actually the Omicron variant or is it a flu or something like that. They're not waiting on maybe the professionals or the doctors anymore to make that assessment. So I don't know if it happens in Antigua as well, but what is happening is a lot of folks are getting certain symptoms, and they're concluding it's the flu, and they're treating it themselves, etc., etc., etc. Are we having the same situations? Because some folks, yes,
not only in Antigua, in the US of A, in England, in the worldwide, and this is flu season, and so one of the things is presentation. What is the difference between, and remember now, COVID-19, the Omicron variant is very flu-like. Very flu-like. Either you don't have symptoms, or if you do, you have very mild symptoms. And so it's very difficult, Webber, for us to differentiate between the flu and the Omicron variant that we have. It's very, very difficult. And so, for me, as a professional, when the patient comes in with the flu-like symptoms, and I'm trying to decide whether this is flu versus Omicron, I go through a template that I have in my office, and sometimes, and I'm going to tell you this, sometimes, honestly, I just by listening to the symptoms, I might be able to differentiate between the flu and the Omicron variant. And it's a very subtle distinction. I was actually just talking to someone about that and trying to differentiate which one you might have on the other one, and it's not an easy thing to do. So my advice majority of the time is for the person to get to the doctor, and in doing so, the doctor should be able to, just if you're a very astute clinician, might be able to give you the differentiate. But if there is a doubt, what do? It's simple. And this is why the American population are now giving you the home kit, so that you can do a quick test and make a determination of whether or not this is COVID versus the flu. So you could do a quick test at home and difference, because it's very little subtle differences between the two.
But here's the thing, Doc. Here's the thing. If there's this minute difference, right?
Mm-hmm.
As far as stigma is concerned, seemingly a person prefers to admit or declare they have the flu as opposed to the COVID-19.
Well, I mean, most people don't want to do that. They're like, okay, we prefer to have the flu than to have COVID, and because of what else is going on in terms of your work and your job and all of these kind of things. The stigma that goes around with the COVID, and that is absolutely correct. So most people say, no, and that's a big problem. Again, this is where we go back to responsibility. The ability of the individual, again, because we need to stop thinking us alone, you alone, but we have to think about the community and the society. If you do, and again, I understand the stigmata that goes along with it, and the fact that you have days, but if you are honest and true, and you want to help in the community or help with the treatment of the disease, you do your test, and if it is positive, it's well. Remember now, Webber, that in essentiality, yes, it is COVID, but this one doesn't last for long. You don't have the long COVID syndrome that a lot of the people who previously had that. And so it's not, the stigmata for this one is actually decreasing now. It's very much decreasing, because everybody and every community have hundreds of these people with the disease, and they put on a mask after 5 days, 6, 7 days, and they're going back to work without any problem and without spreading the disease. So the stigmata is dropping down now, especially with this new variant. So a lot of people may have, or even that they'll do a home test, and they are positive, they stay home, stay isolated for 5-6 days. On the 7th day, and the symptoms are gone, and you don't have any symptoms anyhow. You come back out in 7 days, you put on your mask, and you're gone work. It's not a bad stigma at all now at this point in time. That is changing. The long COVID, the people who are sick and in hospital and on ventilator, and you are spreading a disease that is going to take you down, is no more right now with this new variant, Weber. So, yeah, you are absolutely right. It's a stigmata, but that is decreasing considerably, because now what we're looking at, Weber, and you just said so, it's a little flu-like symptoms that you are getting. And so people are not so worried about that now. The community is changing. People are changing. Again, I think the way out of this, because we cannot contact trace all these asymptomatic people who carrying this disease right now, Weber. It's a waste of time to even think about contact tracing, because so many, you saw your dashboard the other day, so many people have the disease and are home and are around the place. So they are spreading it to more and more and more people, and they are asymptomatic. So contact tracing is becoming a waste of time right now. We need to now decide on how we're going to move forward. Again, home testing. If you're positive, you tap home for 5-6 days, you let them know, and then you come out, because you don't have the nasty, dirty symptoms that we used to get with the alpha, beta, lambda, delta. Those are no more. What we're getting is a flu-like symptoms, and so people need to be brave enough to understand stigmata is not as bad right now. It is COVID-19. The Omicron variant is a flu. That's what's going around right now, and that's where we're going. Dr. Fauci is saying, look, all of us going to get this now. This might be the one that is going to change the future of how we deal with COVID-19, and it looks like it is. It really is, Webbo.
By the way, if you have a question or comment, you'd like to join the doc, call on 1-869-469-1700. In the meantime, Doc, just for the folks who may not be aware of it, or perhaps may have a little cloudy view of it, what are the symptoms that of this COVID, this variant?
This variant, and it's
this Omicron.
The Omicron. And again, you might get a little injection in the eye, a little redness in the eye. You get a throat itch, a little itchy throat. And with the itchy throat comes the little cough. It's a cough where everyone's saying, I'm just trying to clear something in the back of my throat. Again, we're not seeing the massive destruction of taste buds and stuff. You might get a fever. You might get some muscle aches. Very difficult to differentiate. So those are the little subtle things. We're not getting the big junky cough that we see unless you're unvaccinated. You will see people present with maybe a little shortness of breath and the junky deep cough that brings up all this stuff. You will see that happening for most of the patients who are not vaccinated. The vaccinated people, very little throat itch, a very dry cough that is just an irritation like it's a very irritative cough in the back of the throat, and it itches, and when you cough, you don't get much coming up, just a little schism of a little phlegm that comes up. And those are the subtle differences. Now, if you have the flu, you start to get this real bad runny nose. You might get muscle aches, some fevers. You get sick, and you get a nasty, junky cough and cold. And so that's how you know you can differentiate the two. But your physician is probably the best person to do so. And if you don't go to the physician who will tell you what he thinks, then your next choice is to go home, take a home test, check it out, and make sure. But I'm telling you now, people in my office, everywhere I go to work, I see these people who come down with flu. The flu symptoms are very sick, runny nose, achy. You could tell these people have the flu by just looking at them. Whereas the Omicron variant, very little throat itch, a dry, itchy cough from below, and not much of a runny nose, but just a little malaise, feeling a little weak, a little, and things. Very subtle disease and thing. When I see that come into my office, I say, take a test. Whereas the junky cough, cold, flu, ache, you know you've had that one before. I say, yeah, I had that last year. Those ones are the flu symptoms, very much similar to what you know. But this one, the Omicron symptoms are very, very subtle, very weak, and you can easily differentiate it if you know as a physician. But always one thing, Weber, always remember this. Do the test. If you are concerned, do the test because it's the safest thing to do. And most people will tell you, do it now and wait and do another home test 4 to 5 days later. Make sure, and then you move on. But you always have that one thing you can do to help differentiate the two. And it's a quick antigen test at home, or even if you go to your doctor's office and get that done, and that makes a big, big difference, Weber, between the two diseases.
So it is fair to say that the Omicron and variant and the flu are both in circulation currently?
Absolutely. What's the name? The name that they're giving it in France was called Flurona.
Yes.
That's the name that they're giving it because the symptoms and the combination of the symptoms, and some people have both. Some people do have both.
At the same time?
Yes.
Oh, really?
Yes. The Flurona, the flu and the COVID at the same time. Again, how you differentiate it? You do a test, but you have the combination symptoms, or and so the name now is considered in France. The name that they're giving it is called the Flurona. That is so true, Weber. You're right.
Okay. Again, if you'd like to join in the conversation, you can call on 1-869-469-1700 for Dr. Thwaites. We'll be having this discussion. We have a few minutes left that you can get in and either make a comment or ask a question of the doc. Now, Doc, also in terms of there are a lot of discussions and so on because in terms of the things that the islands are doing now in combating this current variant, we're still in some instances locking down the schools, etc., etc., etc. Do we maybe have to in the coming weeks or months? Let me take this call first, Doc, okay?
Mm-hmm.
Hello, good morning.
Good morning, Weber.
Yes.
Morning to Dr. Thwaites. Always very informative for us. Thank you very much for your service. Dr. Thwaites, I wanted to find out, what is your understanding of how much or how many times we have to take the booster shot, or how often we would have to take the booster shot?
Okay, yeah, you finished because we're gonna go to Doc, but we'll have to get you off. So you have any other questions or comments?
For now, that's it. Thank you.
Okay, all right, thank you. Okay, Doc, did you get that question?
Yes, the understanding is, and again, scientifically, we're still looking at whether we're going to need the booster shot or not. What's important is that Israel has started to look at the second booster to the one, so a fourth shot. They've been looking at the data with a lot of those, and so far we have not come to any conclusion in terms of whether or not you're going to need the fourth shot, which is the booster, the second booster. The data is very sketchy. It doesn't look like it's going to be a necessity. Again, hear me, because the data is not completely done, but Israel is looking into the fourth shot. What we're looking at now is that, and most of the data, which I just read from John Hopkins, with the booster, along with the with the whatever your previous vaccine was, whether it's an AstraZeneca and you took a Pfizer, or Moderna and you took a third shot Moderna, and the data is showing that, especially the Moderna, again, for educational purposes, the Moderna, they're saying that with the Moderna shot, the booster shot is very effective against the Omicron, and it looks like it works very well against it. So the fourth shot booster, it doesn't look like it's becoming a necessity, looking at the data from the booster shots that we're getting. Again,
sorry, let me take this. Hello, good morning. Okay, I'm very sorry, caller. Please call back. I'm very sorry about that, and we ask you to be patient. Doc, we were trying to get a caller in. They have gone. Yes, go ahead.
Yeah, so I'm with that now. For the person who called, it sounded like Tessa. Hi, good morning, Tessa. What we're looking at now is do we really need the fourth shot versus what's going on now in terms of the extra boost you're getting, especially with an asymptomatic Omicron variant that's out there. The necessity of getting another booster seems to be dwindling, and it's a lot less because you are now getting to herd immunity with this Omicron variant. But the data for that, whether we're getting, is not completely put out there as yet. It doesn't look like it's going to be that way. But again, if for a chance that this variant, we get another variant out there, then we'll probably have to reconsider. But with the boosters, and also there is a company in Texas or so who's making a booster which contains all of the necessary ingredients or necessary viral particles that is going to be able to protect you from the Alpha, Delta, Omicron, all of those variants out there. They're putting together one booster that is able to do so, and that one is coming on stream. So you just take that one shot and you're being protected against all the different variants that is out there. Again, Weber, the answer to her question is that the data is not completely formed. We're looking at Israel, who's now trying the 4-shot to see what the data is looking at. But from our own Western world countries that are looking between America and the Caribbean, it doesn't seem like we're going to move towards the fourth shot so far. And the fact that we're getting some native or natural immunity from this new variant, because everybody seems to be getting it and are asymptomatic, makes it seem less that we might have to go for another booster shot. It seems that way so far.
If we can look at the vaccine, because, you know, as it came out, there have been lots of debate about it, and, you know, a lot of debate about whether it was fake information and so on. But here's the fact that it has been in circulation now and in operation now for a number of months, maybe a year. But the sky hasn't fallen, has it?
No, it hasn't. That's correct. But so, I mean, it's been, yeah.
We have some time. We've had some time now to get the data and the performance of the vaccine. So you say what?
Yes, and it's important. But look, again, Webo, and if you notice, we're not hearing much from the anti-vaxxers either, the people out there. But what we're seeing more and more, because the data is more prominent, the answers to all of their questions, the Chicken Little, the sky is falling kind of a thing, is no more out there. We are seeing a big difference in most of the data. We're seeing representation. We're seeing things have changed.
Okay, Doc, let me take this. Good morning. Can you go ahead?
Good morning. Is the Sinopharm a vaccine or tablet?
Could you ask that question again,
The
please?
Sinopharm.
The Sinopharm, is it?
a tablet or vaccine?
Okay. All right, so that's it?
Thank you.
Okay, thank you very much. Okay, Doc, you got that question?
Yeah, I got that question. The Sinopharm is a vaccine. That's the Chinese vaccine, which is very similar to the attenuated polio vaccines and the old school vaccines that we use. It's a killed form of the COVID-19 virus that they give you back, and you develop the antibodies to that virus because it doesn't cause you a disease entity, but it's attenuated so the body sees it as the virus attacking it and develop the antibodies. But that's one of the old school one. It's very similar to the ones that we used to use for polio. Again, as people, we were talking to people and people saying, "Oh, these are the new variants and new this and that." We also had some of the old school vaccines that are available there, and Sinopharm is one of them. It's not a tablet.
Okay, fine. So, we were speaking about the resulting effects now.
Yes,
you have
yes.
the data and so on too. Because, Doc, I read a quotation one day, and that's the reason why I wanted you to reiterate it, because it says to combat a lie, tell the truth over and over and over again.
And that's what we're doing, and then that is so right. But Webbo, and I keep saying, for the ones who felt that we would have been growing two heads, it's been a year. It's going on. We're going on 2 years since the vaccine, and that we would have had what immune escape, and that we're going to drop down dead. But their predictions, we're not seeing that anymore. We're not seeing all of these things, and these people are staying quiet. And you're right. Continue talking the truth to combat the lie. And the truth is, and we're seeing it, and it's working, and it's effective, and majority of people are still going out who were watching are getting the vaccines, and we're not seeing, remember all these people who were supposed to be dying and done dead and disappear, we're not seeing it, and all the blood clots that they were talking about, that sounded like a bad word there, however, right?
Yes.
Blood clots that they were talking about, we're not seeing that. And again, we are now looking at a new variant that is flu-like, very flu-like, asymptomatic carriers. People are getting immunity, and they do not long-lasting, but the vaccines are still important and necessary to help us keep at bay the other variants, which is what it's doing, and things. So all this immune escape and the death and all of that, you have quelled those people, because when we look around, people are still alive. Nobody gets in the blood clot. Nobody, and we are protected. Majority of the people, again, and again and again and again, I keep making the statement. We're looking at in Antigua, we just picked up 300 and something cases. Majority of them at home. We have 15 people in the hospital, a little bit short of breath or with something, with possibly more than likely the new variant. We're not seeing the people in the ICU setting. And again, majority, and I keep saying so again, people don't want to hear, nobody wants that. Majority of the people who we see out of that 16, 17 people in the hospital, they are unvaccinated. The people who are vaccinated get this disease, it slips around, it goes away. People who are boosted are even doing better. The virus doesn't even, when the virus hit them, we're looking at the count now. They do the PCRs are giving you the count. When the virus hit these people who are boosted, it just disappears. The count goes up a little bit, but they go away, and they don't even have a symptom. All they know that they were touched with this virus, but it disappears right away. No symptoms, asymptomatic. And so, yes, Weber, we're looking at times where the sky is falling thing and everybody looking up and running. It's no longer no more. The anti-vaxxer are not stressing us because they're realizing now the massive change and the difference it is that the vaccines are making, and now it's even better that you are fully boosted, and if you have caught the Omicron variant, you develop some other natural antibodies, and so you are superly well protected from getting this COVID-19. And I think this might be the one that changes the ball game completely for us, because it's very, very asymptomatic flu-like. Nobody dropped down with it unless you're not vaccinated, where we see these people are now filling up most of the hospitals because the disease has a massive toll on them, even though it's a flu-like symptoms for most other people.
There is a debate ongoing, Doc, that if you were to contract the Omicron and then you were to get through and get better and all that, you do not need, and you were unvaccinated, you do not need thereafter to get vaccinated.
Absolutely incorrect, again. And we started the program talking about the Sinopharm, which is the virus naturally attenuated, which form. What they realized is that the native immunity you get from that doesn't last as long as if you took the vaccine. So the people who get this Omicron variant, even though, remember, it's contagious, but it's mild symptoms, even though they develop some antibodies against the stuff, it doesn't last long. And that's why I went to the same vaccine the lady just asked about, the Sinopharm vaccine, because I wanted to put out there that we, even with the vaccine, which is the killed form, which gives you a natural immunity, we still get a lot of breakthrough infections after a period of time on the Sinopharm vaccine, which makes they want to run and give you another booster in a quicker form for the Sinopharm, because this immunity that you get naturally, hear me again, Webo, natural, and the reason why I say it's natural, because they just attenuate the virus. They either give you a killed form or they turn down its virulence and give it to you so you don't get the disease, but you develop the natural antibody. They don't last for very long, and that's why the Sinopharm vaccines were getting all these breakthrough infections in the Seychelles and all these places, because the immunity, the natural immunity that you get, doesn't last as long as if you get the vaccines and, again, the booster shots and all of these stuff. They last a little bit longer and you get more protection. But a combination of the natural or the attenuated turn down with the other vaccines and the boost, the messenger RNA ones and whatever, you do and fare better off than just saying you're getting immunity because you have picked up the Omicron variant. It doesn't last for very long, however.
Another prevailing view that you hear, especially currently, some folks are saying that they would like to get the Omicron, and having gotten it, they cannot get it again.
And we are seeing that is not true. And if we know, then I could reference a few people who have gotten like the Delta variant, or one of the Delta variant, or the Beta variant, who have now picked up the Omicron. Again, you can, and more than likely will get, even if you don't get the Omicron, you can also end up getting a Delta or a Beta or an Alpha, because yes, the immunity is not long lasting. The native immunity that you get from that virus is not long lasting. So that is not a true statement. We're seeing people who are getting a second infection. You go out there and you hook up with someone who has that disease, you will get a second dose of that virus, and in quick succession too.
So the bottom line, Doc, it's still important, if you haven't gotten the vaccine as yet,
It's very important. It's very important because you are getting I hate to say it, the more the merrier. You have the vaccine, and even if you pick up the disease, you have a lot of different types of antibodies against this COVID-19. So even if there's a new variant coming out next couple of weeks or couple of months, you have good amount of protection. You have a natural protection, and you have the ones from the vaccines. So you have plenty protection against the disease entity. So even if you get it, it might not be as bad. Just a mild little flu symptoms, and you can move on. And your downtime is a lot less, Weber. A lot less downtime. The unvaccinated are down for at least 2 weeks, Weber. 2 weeks. Whereas if you're fully vaccinated and you pick up this new variant, your downtime is 5 to 7 days. And if after that you're still positive, they give you 10 days. They say go for 10 days, and they say don't even bother test if you're asymptomatic. Just go right back out. That's what the data is saying now. Big difference in wait time. And we said so before in the past. The difference between a vaccinated and an unvaccinated is just 2 weeks. It takes you 2 weeks to develop the immunity, whereas a vaccinated person, it takes them a couple of hours a day to have these antibodies, a couple of hours to have these antibodies ready and fight off the disease, so the virus doesn't have an opportunity to propagate. And so you have good protection. And that's what everybody keeps saying, oh, but you can still get it. Yes, but you have protection. The whole idea is to prevent, not to completely eliminate the disease from getting it. When the disease gets to you, you prevent it from propagating or spread. We need to understand the difference in the terms that are being used out there. No vaccine has prevent you from getting the disease. It stops the disease from affecting you or spreading in you. That's what it does. It doesn't say, don't come here because I'm vaccinated. You come, and then it fights it off. But it does it in a quick, short period of time. Pop, and you're gone. So yes, most people who are vaccinated disease will probably try and get to you, but when it gets there, you have a defensive wall to stop it from propagating, spreading, or multiplying. Hence, if you stop it from multiplying, you don't get all these variants from developing.
And finally, Doc, what would you say to persons who might be able to maneuver this fourth wave, is unvaccinated, and did not contract the COVID-19, and they perhaps feel safe going forward to remain unvaccinated?
Well, you're pretty much setting yourself up as a walking time bomb. Again, and we see this all the time. It's like disease is out there, and you're not trying to protect yourself, but you're going to walk through it. It's like it's like using a condom or not using a condom. You're going to go out there, put yourself in a situation where you might be able to pick up disease entity because you think that it's safe, and you go and then you pick it up. If you have protection on board, you go and you do what you got to do, and you feel safe, and the people who feel, and they have braved the weathers, and then we have a few out there, and if that's the chance they want to take, you allow them to, because when you get the disease, it's usually very horrible for you that's unvaccinated. I don't know if you remember back in the day, they tell you if you get measles or chicken pox when you're old, how horrible it is, right? You remember those days?
Yes.
They said, boss, the worst thing you can get it when you're old, right? Because you're moving around without being vaccinated, and when you catch them when you're old, it's horrible. It takes you down easily. Whereas if you're vaccinated, you just keep moving. You don't have to worry about these things. So the persons who are unvaccinated, who feel comfortable now that we're getting to herd immunity and people are getting the disease, you take your chance. You wait, you see, because when you do get the disease, especially with all the protection that's out there, it is very horrible, and it usually becomes worse. So you might as well just go ahead and use your protection. Prevent yourself from getting there. We practice what kind of medicine, Weber? Preventative medicine. We don't put you out there people go to get covered. We try to stop you from getting sick. That's what we do, and that's what the vaccine does. It is preventative medicine. So if you're comfortable and you feel you don't need none and you weather the storm, it will probably catch up with you because it did.
Okay, Doc, we got someone here for you. Hello, good morning. Okay, that person. I'm very sorry, but if you call back right away, we'll be able to get you before we leave, because we're just about getting ready to leave, Doc. Someone was trying to... Okay, I think the person is back, so let's see if we can accommodate them. Hello, good morning.
Hello, good morning.
Yes.
Just two quick questions. Where can one get an antibody test in the Federation? And how effective is the vaccine compared to other vaccines for other diseases in terms of the breakthrough rate?
The other diseases, you mean other than...
Like measles vaccine, chickenpox, smallpox vaccine and stuff like that.
What's the question with that?
What's the efficacy rate compared to the efficacy rate of the vaccine for this virus compared to other vaccines for other viruses?
Oh, okay. All right. Thank you.
Okay.
Right. Doc, I don't know about the first question. Where can we get the test? If you can handle that, but...
No, that one I can't handle, but
Yeah.
When initially... For me, I can answer from Antigua. I do have some of the kits in my office to do the antibody testing. And when they started to mandate the vaccines, people who, and that's an appropriate question to what we're talking about too, Weber, people who caught the disease wanted to present that as that they have immunity against the virus. And so some people will come in to see me because the tests are available. Most of the labs, they have them out there. They are available. It's a simple kit. You take a blood prick and they put it on the stuff and it will tell you whether you have the IgG, again, big terms, and IgM, which is just the antibodies. And what the problem why we stopped it, we could not tell whether this disease were active disease or whether the person had the disease and now has developed the antibodies. The antibodies are around because the person had the disease. So that's why we went to the antigen and the PCR test. But those tests are available. I don't know if maybe most of the labs might have them. But again, when you want to ask to go back to your job because you were out for 14 days because you had the disease, we were able to test you and say the person has antibodies, so they have a protection. But if there is a cross reaction between the IgG and IgM, it means that you might have active disease, so you can't go nowhere and stuff like that. But yes, those tests are available. The other question was, again, the effectiveness. Again, when we first looked at the data and we were looking at effectiveness of the disease, they gave you some numbers out there. It is 60%, 50%. When we were looking back in the day, and it's a very, very, very good question. Kudos to the person who asked that question, because when we were looking at the data back for polio and mumps, measles, and rubella, the effectiveness, Weber, was about only 50%. And you would laugh, because we're looking at AstraZeneca, where they're saying was 64%. The messenger RNA was about 95% with it. One of the things, and I keep stressing this, Weber, to you and to the gentleman who called, is that when we were looking at breakthrough infections for the people who were getting mumps, measles, and rubella vaccine, we noted that a lot of people were getting the breakthrough infection. Again, Weber, and the reason why we could tell that they were getting the breakthrough infection for people like who had, let's say, chickenpox or smallpox, one of those. When we gave the vaccines, what they noted, the people who were vaccinated usually get one smallpox on their skin. It means, and what it means is that you got the disease got you breakthrough, and you got it, but it's only one pox because your body, the antibodies that you got from the vaccine protected. Whereas a person who was not vaccinated, whole body would full off with these pox. So what you're seeing there is, yes, we were still getting about 50-60% breakthrough infections with these vaccines, but it was very minute, very small. So we never see the representation. Here is the difference again, Weber. It was the part of the body that these viruses affect. With the COVID-19, it's the lungs, and it's easily spread. So you will know when you get the breakthrough infection. For mumps, measles, and rubella, remember you get the fever and the flu and you get some skin lesions. It did not affect. If it got to your lungs, it was very late stage measles that get to people's lungs. Very late stage. But because of the presentation, the little skin lesions that you get for the measles, people were getting them but didn't know. It wouldn't last for long. It was very small, and so the effectiveness of the vaccine was not measured as when you have COVID, where your lungs are very affected. So the breakthrough, the little disease that you get because you were vaccinated, and then it's represented, is about the same or even better. We've got better effectiveness with the COVID compared to the polio and the MMR that we were getting. It was about a 50% effectiveness we were getting, but that was good enough. But people were not presenting with the severe symptoms like multiple skin lesions. They were only presented with one liquor virus, but we still were having the breakthrough infections because they only got one disease, 2 liquor spots, 3 liquor spots here. But it was occurring, and most of the data was showing it was back then for the measles, mumps, and rubella and the polio, it was about 50% of effectiveness compared to what we're seeing now with MMR, which is 95, 75. And even though we're getting the breakthrough infections that he's referring to, it's not as bad as back in the day. You were getting breakthrough infections, but you were only, because of the area that the area of the body that the disease affected, it was not represented as a major problem. Here with COVID, when you get a breakthrough infection, it affects your lungs, so you will see more symptoms, more signs than the others. So the effectiveness or the breakthrough infections was a lot more with the mumps, measles, and rubella compared to what we're seeing there, but it's just a matter of presentation. The symptoms that we're seeing is a lot worse with the COVID disease, even though the breakthrough infections are probably more than likely a lot less with the COVID vaccine.
And to the first question, caller, what I will do, I'll suggest to you that you can call any of the health centers and ask the same question, and I myself will try and ask, and maybe tomorrow morning at between 6 and 7 I can give you the answer for that as to where you can get those stuff. Okay? Well, thank you very much, Doc. Again, a Happy New Year, and let's hope that, as you perhaps are suggesting, this might be the thing that gets us through, right? A blessing in disguise.
It looks like it might be, Weber. And for most of my patients in St. Kitts, I'll be in on the 27th.
The 27th.
Yeah, we have in clinic on the 27th in Nevis, and then I'll be over in St. Kitts on the 28th, I think. 27, 28, on the 29th.
Okay, so you will be between the 27th and the 29th?
Mm-hmm.
Okay, between St. Kitts and Nevis.
I'll be in the Federation. And thanks again, Web, and Happy New Year. And to the people of the Federation, people who are listening to Varna Radio, all the best for the 2022. Hopefully we'll be able to do more, and we'll be healthier.
Okay, Doc, thanks much again, and all the very best.
All right, thank you. Okay, bye.
Bye-bye.